Good day, everyone, and welcome to this presentation on ethical distinctions in end-of-life decisions. Today, we'll delve deeply into some sensitive yet crucial topics: passive euthanasia, mercy death, and mercy killing, and explore them through the lens of the value of life principle. I'm looking forward to guiding you through these complex ethical considerations with care and clarity. Let's begin. Here, we focus on the fundamental idea that human life holds inherent value. This concept is crucial because it serves as the foundation for making moral judgments, especially in fields like healthcare and law. When we talk about end-of-life practices, this principle reminds us that respecting life is at the core of ethical decisions. It's not just a rule, but a guiding framework that influences how we compare and evaluate different approaches to care and legal protections in these sensitive situations. The image here captures a lively, energetic scene that symbolizes the vitality and importance of human life in our communities. On this slide, we're focusing on defining passive euthanasia. The first key point is about withholding or withdrawal. This means intentionally stopping or not starting life-sustaining treatments, like turning off a ventilator or stopping dialysis. The goal here is to let the underlying illness take its natural course without further medical intervention. The second point highlights the key characteristic of passive euthanasia. It's essentially about non-intervention, where the outcome is death following the progression of the patient's illness. The image of the hospital room reinforces the context where these decisions are often made, emphasizing the clinical environment and the serious nature of these choices. Here, we delve into the concept of mercy death, which centers on compassionate relief. This idea involves actions taken to ease unbearable suffering when death might be anticipated but is not the primary goal. The key point is the intention behind these actions. It's about alleviating pain and discomfort, not actively causing death. The image to the right illustrates this beautifully, showing a caregiver offering tea to a patient, emphasizing the warmth and care involved in providing comfort during difficult times. This compassionate approach is essential in understanding the ethical and emotional aspects of mercy death. When we talk about mercy killing, we're referring to an active intervention where lethal means are deliberately administered to end life. The main intention behind this act is to relieve suffering by causing immediate death. However, this practice brings up significant ethical and legal concerns. Because it directly causes death, it challenges our ideas about consent and morality, sparking strong objections in many societies. The image here, showing two hands clasped together, symbolizes the deep connection and emotional complexity involved in discussions about mercy killing. Here, we're looking at three ethical frameworks that help us understand different perspectives on the value of life, especially in the context of euthanasia. First, deontology emphasizes the importance of duties and moral rules. From this view, human life is an inviolable right, and actions like euthanasia are generally opposed because they can violate these fundamental duties. It's about sticking to principles regardless of the outcomes. Next, consequentialism evaluates the morality of actions based on the results they produce. If euthanasia leads to better overall consequences, such as reducing suffering, it may be considered morally acceptable. This framework focuses on the balance of benefits and harms. Finally, virtue ethics shifts the focus from rules or outcomes to character and compassion. It highlights the importance of mercy and kindness when considering euthanasia, valuing the intention and moral character behind decisions. This approach encourages a more nuanced, empathetic perspective on the value of life. Together, these frameworks provide insight into the diverse ethical considerations surrounding euthanasia. Here, we focus on understanding the different intentions behind end-of-life decisions and how they affect moral judgments. First, we look at passive euthanasia intent, the choice to allow natural death by withholding or withdrawing treatment without intending to cause death directly. This approach reflects acceptance rather than intervention, aligning with the principle of valuing life while recognizing its natural course. When we talk about consent and autonomy in end-of-life choices, informed consent is absolutely crucial. It means that patients need to fully understand their treatment options and make voluntary decisions without any pressure. This ensures their autonomy is respected. Advanced directives play an important role here too. They allow individuals to record their wishes ahead of time, in case they lose the ability to make decisions later on. For example, a patient who is currently competent may choose to refuse life-sustaining treatment based on their personal values and careful consideration. This approach helps honor their preferences even if they can't communicate them in the future. When we look at the legal perspectives and precedents surrounding euthanasia, there are some clear trends and notable differences. Generally, laws tend to make a distinction between withdrawing treatment, which is often permitted, and active killing, which is usually prohibited. This reflects a balance, where legal systems aim to protect life, but also acknowledge patient autonomy to some extent in very specific situations. On the other hand, the comparative legal status varies widely across jurisdictions. Some countries allow passive euthanasia, meaning they permit letting a patient die by withdrawing or withholding treatment. Meanwhile, other places have more restrictive laws or even consider all forms of mercy killing illegal. These examples underscore the diverse legal approaches taken worldwide in dealing with such a complex and sensitive issue. Here we explore the moral and societal implications of euthanasia, broken down into three key concepts. First, passive euthanasia is often seen as letting nature take its course. While many consider it a more acceptable approach, it brings up important questions about medical trust and the responsibilities of caregivers in end-of-life situations. Next, mercy death is generally perceived as compassionate, yet it remains controversial. It sparks ongoing debates about where ethical boundaries lie and how we respect patient dignity during these difficult moments. Finally, mercy killing is the most provocative, as it involves an intentional and active step, which triggers significant public concern and fears of a slippery slope. This highlights the intense moral challenges society faces when dealing with intentional, life-ending actions. The image here, showing healthcare workers in a sterile corridor, underscores the clinical and human context in which these complex decisions are made. Here we have three case studies that highlight important ethical distinctions in end-of-life care. The first scenario is passive euthanasia, where life-sustaining treatment is withheld from a terminal patient. This raises the question, is it ethically justifiable to withhold treatment in such cases? The second scenario involves palliative sedation, used to relieve unbearable suffering. Here, the key ethical consideration is whether sedation respects the patient's dignity while alleviating pain. Finally, the mercy-killing scenario entails a caregiver actively administering a lethal injection to end suffering. This brings up a complex ethical dilemma. Is active intervention permissible when the goal is to prevent further suffering? Together, these cases help us explore the nuanced ethical challenges healthcare professionals face in respecting patient autonomy and dignity at the end of life. Here we have a summary of the key ethical differences related to end-of-life actions. The table breaks down three main types of actions: their primary intent, the role of consent, and their typical legal status. First, withholding or withdrawing life-sustaining treatment is primarily aimed at relieving suffering without directly causing death. Here, consent plays a critical role, and this action is usually legal as long as established protocols are followed. Next, administering medication to hasten death focuses on alleviating unbearable suffering. This usually requires explicit consent from the patient, and while it is legal, it's only permitted in limited jurisdictions. Lastly, a deliberate act to cause death without explicit consent involves ending life to relieve suffering, but lacks clear consent. This is typically illegal and remains highly contentious. Understanding these distinctions is crucial because they reflect the complex ethical and legal landscape surrounding end-of-life care decisions. Consent and intent are central factors that influence the acceptability and legality of these actions. As we conclude, I want to emphasize the profound value of human life, especially when we're faced with complex and challenging decisions. Providing compassionate care means sometimes making tough judgments, but it's crucial that we always balance three key elements: protecting those who are vulnerable, respecting each person's autonomy, and carefully weighing the intent and proportionality involved in end-of-life choices. We must prioritize honoring validated patient wishes, apply relief of suffering in a way that's proportionate, and ensure all actions are supported by strong legal and ethical safeguards. This approach not only upholds dignity, but also fosters trust and compassion in the care we provide.